Good afternoon. I'm Mehdi Razavi. It's my honor and privilege to introduce you to Dr. Mark McCauley, MD, PhD. He is the director of the training program, Cardiac Electrophysiology at the University of Illinois in Chicago. And he is on the forefront of some remarkable electrophysiology research. But perhaps most importantly, he's also one of our own. He is an alumnus of the Texas Heart Institute, and he has now come back, gave a wonderful grand rounds. And my first question and ask of him is to give us a kind of a more of a brief summary, a lay summary for those of us who are not necessarily as well versed in the field, to just give us a background of the work that he's doing and what he thinks this will end up, how this will end up affecting clinical care.
Thanks very much, Mehdi, for having me. We've been working with carbon nanotube fibers for, I think, well over a decade. We've had a really nice collaboration with your laboratory and Dr. Matteo Pasquale at Rice University. And, it really started with a pretty basic question, which was, there's a new material, a nanomaterial that conducts very well. It conducts electrically, it conducts thermally very well. Could this be of use for electrical conduction in the heart? And we started out with individual cells, showing that we could conduct electrical impulses from one cell to the other. And then we scaled it up to small hearts in a research laboratory setting. And then finally, we progressed to large animal models where we showed that, we can pick up electrical conduction from one part of the heart and deliver it to another part of the heart, which has a lot of value to cardiovascular disease and patients who are suffering from cardiovascular disease. As you know, reentry is a major problem for arrhythmias in the heart, and reentry is where an electrical impulse goes around a boundary, like a scar. And one of the problems is the slowing of electrical conduction. So if you can gather electrical signals from one part of the heart and deliver it to another part of the heart, it has a lot of value in trying to reduce arrhythmias and hopefully restore electrical conduction to that the scar could have taken away. So where we found this most useful, and we've developed some recent data showing that when you are able to bridge a scar with these carbon nanotube fibers, it causes simultaneous activation electrically on either side of the scar. And this simultaneous activation causes the arrhythmia to essentially short circuit the short circuit. And what that means is that it can terminate an arrhythmia so that it never starts in the first place. And I think that that's one of the final frontiers in electrophysiology, is being able to stop an arrhythmia before it starts in the first place.
Yeah, prevention is absolutely the most important step, because right now, what are the treatments out there that we have for these?
Yeah, the treatments are somewhat limited for reentrant arrhythmias that include arrhythmias like ventricular tachycardia or complex atrial flutters. So you can use a catheter to try to ablate some of the scar tissue that may be existing there. But one of the limitations of catheter ablation is that you're essentially treating scar by developing more scar. You're essentially just making the scar shape a little different to make it less arrhythmogenic. But it's not really a restorative method. And I think that that's where these carbon nanotube fibers shine, is that by restoring conduction, you can hope to take the myocardial conduction back to where it was before the scar formed.
So basically the scar creates a lot of delay, and in this case, even though we think delay means slow heart rate, that delay can actually lead to this situation where you're describing, where you have a circuit going around that area of scar. And if you eliminate that delay, which is what you're doing, you believe that can, and it should, based on everything that we know about cardiac arrhythmias, it should prevent the onset of those arrhythmias.
That's exactly right. And we showed some data that if we were able to speed up the conduction across the scar, it actually reduces the onset of these arrhythmias. And really, this is the first time in all of arrhythmia science that we've shown that by restoring conduction, you can actually reduce reentrant arrhythmias. So I think that that's really unique.
Wow, that's great. Because right now the treatments, as you said, involve basically shocking the heart back into normal rhythm. That's one of the standard treatments.
Right.
And if you could prevent the need for that, that really makes a huge, huge impact.
It makes a huge impact to the patients in terms of less arrhythmias, but also you want to try to avoid shocks, as you know, because of the limitations and setbacks with that. So I think that it could be a better treatment that also causes less pain.
Right. And we're talking about the shocks, we're talking about the implanted defibrillators that are like pacemakers, but they also shock the heart when the heart's going fast. So it would eliminate that.
Exactly.
So how long do we have to wait at this point?
Well, it's a really exciting technology. We've already done some biotoxicity studies showing that this is not toxic to the heart. So I do think that, with a couple of other studies, maybe in the next few years, we can start first in mankind kind of clinical trials, really.
So any other, these fibers, they sound like they're really, really unique technology. Have you drummed up any other great ideas that this could be, this technology could be used?
Sure. Well, bridging a scar is, I think, a great first step, but there's other applications for restoring electrical conduction in the heart. So, for example, if you could restore conduction from the atria to the ventricles, which is the natural electrical flow in the heart, then you may be able to replace pacemakers and the need for generator changes. So that's one thing that could be helpful. Another hot area in electrophysiology right now is going after the bundle branches, which are within the ventricle. So
the wiring to the bottom chambers of the heart.
Exactly. So if you could have a restorative method for this, it actually might help heart failure patients too. So I think that those are other exciting applications for this material.
Wow, that's pretty remarkable work that you're doing. Anything else you'd like to share with us about your lab and the work that you're doing?
Thank you. In addition to the carbon nanomaterials work that we've been doing in collaboration with your lab and Dr. Pasquale's lab, we're really interested in preventing stroke in atrial fibrillation. Recently we published a paper in Circulation Research where we show the mechanism of how strokes form in atrial fibrillation. So the goal of this research is to try to prevent strokes without the need of a blood thinner. So that's one really interesting application. And we're also enrolling patients in the NIH-funded clinical trial trying to prevent dysautonomia or a fast heart rate after developing COVID. So we have 2 different kinds of treatments that can help these patients, and we hope that this clinical trial can shed some information on how best to treat patients if they're suffering with post-COVID symptoms.
Thank you again for coming back, visiting us, and we really look forward to another update with you.
Thanks, Mehdi. I really appreciate it. It's such a pleasure to be here and share our progress.
Thank you.